6:37 this morning. Welcome back to Alabama News Network. It's Wednesday, so that means we're being joined by Dr. Kathy Lindsey, and we'll take your healthcare questions now. Call us at 1-800-504-4084 or 420-TALK. Dr. Lindsey, thank you so much for being with us again.
You're welcome.
Appreciate it. So we wanted to talk a little bit about breast cancer awareness, the risk factors, stuff like that. We talked about it a little bit last week, but we've got our Tickle Pink Expo coming up that's helping bring awareness to breast cancer. So talking about risk factors, what can increase your risk for breast cancer?
Well, just the genetics of it is the most common. If you have a family history, if you have increasing age, most of the time it occurs between 50 and 70 years of age. Estrogen exposure, long-term estrogen exposure can increase your risk. Postmenopausal obesity, people that gain weight once they become menopausal, that's a very high risk factor. Plus some other just things we can change, like smoking, alcohol use, night shift work, those things all can increase it.
Oh boy, I've got like two of those in there. Night shift work and estrogen exposure. Now, when you say estrogen exposure long term, does that mean birth control? I mean, if you're on birth control for a long time?
The data on that's still out. It's mostly talking about menopausal hormone replacement, but women that start their cycles early and go through menopause late, that means they have their own endogenous estrogen load higher. That means what you're making is higher. So in retrospect, you might say long-term hormone therapy with birth control might do it, but mainly we're targeting women, whether or not you should be on hormone replacement after menopause and how long you need to be on it.
All right, we have a question.
Great.
You're on with Dr. Lindsey. Do you have a question?
Good morning, I do. Currently, I'm on blood pressure medication because I've gained so much weight, and I've been on a real good healthy eating plan and exercise plan, and have dropped quite a bit of weight. I'm about within 25 pounds of my goal. And my question is, will I get to the point that I won't have to be on blood pressure pills anymore if I get down to my target goal weight?
Yes, that's a great question, and I tell people all the time, as little as 5 to 10 pounds of weight loss can lower your blood pressure about 10 points. So it's depending on the severity of your blood pressure, what's causing it, and if you only had the high blood pressure due to gaining the weight, most likely you will be able to stop the medicine, but just seek counsel with your doctor so they can monitor that and get you off of it when you need to be.
And you were talking about weight gain can be a factor in breast cancer as well.
It can be. Postmenopause, a BMI over 27 once you become menopausal does increase your risk of breast cancer. So definitely watch what you eat, exercise, decreasing the amount of fat you eat, increasing your exercise, and breastfeeding are some things you can do to help prevent breast cancer or help protect yourself.
We were talking a little bit about birth control earlier, and as far as being on the estrogen, that you're exposed to it for long periods of time, a lot of people, and this is a little bit off topic, but they'll say, well, you don't need to take a break from birth control. Is that true? Can you take a pill, the birth control pill, for years and years and years and not take a break, and it's not going to harm you, or do you need to take breaks in between there?
Well, it's depending on long-term goals, when you want to get pregnant, things like that. People can do take them long-term, because now we have very low-dose pills versus some of the higher-dose pills that were only available early on when they were out there. So low-dose pills, as long as you're monitored and get your routine screenings, can be safe. You just have to consult the physician.
Okay, we have another question. You're on with Dr. Lindsey. Do you have a health question for us?
Hey, how are you doing this morning?
Good.
I'm calling because I'm 28 years old, and I take a Lupron. And that puts me in postmenopause. And hello?
Yes, go ahead. Go ahead.
Okay, and it put me in postmenopausal, and I'm only 28, and I've been on this Lupron for 5 or 6 years.
Okay, let's make your postmenopausal.
Lupron is a medication that a lot of physicians use to treat endometriosis, and that can cause some hot flashes and menopausal symptoms and put you in that postmenopausal feel. You can, get off of that if there's other things the physician recommends for the endometriosis or certain surgical procedures that you might be a candidate for. So if you're having trouble with the medication, speak with your OBGYN to talk about other options that are out there for you.
All right, Dr. Lindsey, thank you so much for being with us.
Great.
We always appreciate you being here. All right, and toss over to Tim.